बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक वसल्लिम अलैहि। My dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. Today we are going to scan the normal kidney, what is the appearance, its anatomy, so somewhat detailed sonographically, which we can see. So I'm going to scan it, tell you the some detail of the kidney. First, we should keep the patient in supine position and then the right lateral or left lateral decubitus position to scan the kidney. So kidney, it is a retroperitoneal structure, and this is the right kidney, and the patient is in the right lateral decubitus position. Here we can appreciate the right kidney, this whole structure, the right kidney, and this echogenic line, which is all around the kidney. This one, it is the capsule of the kidney. So from outer to inner, we can appreciate this one. This is the cortex. This one, this is the cortex, and this black structure, this black structure is the pyramid. It is called medullary pyramids. And then further in the center, this area which is more echogenic than cortex and medullary pyramids, this is the renal sinus, called renal sinus. This is the anterior, and this is the posterior, this is the superior, and this is the inferior region. So at this side is the upper pole, superior pole of the kidney, and this is the inferior or lower pole of the kidney. And in between this region is the interpolar region or mid-polar region. We cannot call it mid-pole, so it is the region between the two poles. Only two poles are present in the kidney. This anterior side, this cortex is the anterior cortex and the anterior medullary pyramid, and this is the posterior region in the screen. This is the posterior cortex. So outer layer is the cortex, which is hypoechoic but less hypoechoic than pyramid. It normally less than the hypoechoic, less hypoechogenicity than the liver. And these are pyramids which are dark. And then sinus, renal sinus, which is bright than the cortex and pyramid. Why this renal sinus is bright than other? Because here maximum fat is present, connective tissue is present, collecting system is present, and the blood vessels are present here. So all walls of all these structures, they make the interface more than the pyramid and the cortex. So when these form the interfaces, there is a significant reflection of the sound waves from these renal sinus due to the interfaces, and then more reflected ultrasound sound waves goes back, resulting in this increased echogenicity of this renal sinus. तो जितनी रिफ्लेक्शन ज्यादा होगी उतनी एकोजेनिसिटी ज्यादा होगी, जितनी रिफ्लेक्टेड साउंड्स कम जाएंगी उतनी जो है ना आपको brightness कम होती जाएगी. So this was the basic physics which I want. So why this is darker? Because here more fluid is present which transmit the sound waves, so reflection is less as compared to this and as compared to the cortex. Cortex में भी glomeruli हैं, tubules हैं, vessels हैं, interfaces भी होती हैं, तो ये moderate sound reflect करता है, due to which it reflect moderate sounds as compared to this one pyramid. So ये थोड़ा सा it seems more bright than the pyramid but less bright than the renal sinus. So we are talking about the cortex. So this cortex, it contains the glomeruli, proximal and distal convoluted tubule and micro vessels, which we call the vasorecta, which we cannot appreciate on the ultrasound. So these structures within the cortex cannot be appreciated on the ultrasound. Only this cortex is present. And what is the function? Glomeruli, we all know that it function is filtration. So ये filter करता है. Due to this, the more I can say that almost 80 to 90% the blood flow is within the cortex, while 10% blood flow goes to the pyramids, which does not take part in the filtration. Only it helps in concentration of urine and then transport this urine from this pyramids medullary system to the collecting system. So this was about the culture. Now, two things: how we measure the cortex and the parenchymal measurement. When we consider that we are going to measure the cortex, we should measure the cortex portion only from the up to the pyramids. If we measure the parenchyma, then we should include the pyramids, and then we should go up to the renal sinus. So this is the two different things, because the urologist sometimes need the cortical measurement, sometimes need the parenchymal measurement. So we should also be conscious about this. We should not include this sinus only up to the sinus. So this is the parenchymal, and if we want to measure the cortex, this is the cortical measurement. And the length we should measure from upper to lower throat, and then we should thickness from the anterior to posterior. So this should be measured. 9 to 11 is the common size of the kidney in the adult. So what we have learned now, the cortex, renal medullary pyramid, and the renal sinus, upper pole, lower pole. So from the pyramids, this pyramids, which is usually conical in shape, the base is toward the cortex, it is broad, while the conical shape, this conical region, which is called the apex of the pyramid, medullary pyramid. Here, the lower calyces, which is the collecting system of the kidney, it surround the apex of the pyramids, and then there is an opening at the apex of the pyramid through which the urine transport or urine comes from this medulla or pyramids to the calyces system, collecting system. So first here which the calyces which collect the urine from the pyramid are the minor calyces. Almost 8 to 18 minor calyces are present in the upper, mid, and lower pole region. So these carry the urine, and then these combine minor calyces form the major calyces, which are 2 to 3 in number, and then major calyces combine to form the renal pelvis. So from here, minor calyces from the lower pore minor calyces, and from the mid pore region minor calyces. Then these combine here at the renal sinus, where they form the major calyces, which are 2 to 3 in number, then each kidney, and then these major calyces form the renal pelvis. Here, this is where the renal sinus fat is present. This is the area where renal pelvis is present. As until there is a mild hydronephrosis or until there is a dilated vessels, we cannot appreciate the collecting system. So when the mild overhydration is there, जब ज़्यादा हाइड्रेटेड है पेशेंट और उसके कैलिसिस में प्रोमिनेंस आ गई है, कुछ यूरिन कलेक्ट हो गया है, so then we can appreciate the collecting system, upper, mid, and lower pole calyces, and also the renal pelvis. Otherwise, if they are compressed, we cannot appreciate in the normal kidney. So from the renal pelvis, then ureter, then from the renal pelvis, the urine then goes into the ureter, which is a collecting duct, starting from the renal pelvis. Then it goes through the retroperitoneally through the abdomen, and then posterior to then it crosses the iliac vessels, and also then reaches the urinary bladder. Then it reaches urinary bladder, then it is sorted into the urinary bladder as the vesico-ureteric junction. So this is the normal anatomy of the right kidney, and same anatomy will be the left kidney, which we will come across. So then other is the blood vessels. There are many blood vessels, branches of the renal artery within the kidney. First there is a renal artery, then is the segmental arteries, then is the interlobar arteries, which are present in between the pyramids, portion in between the pyramid, then is the arcuate arteries. So this we can appreciate these. There should be equal flow towards the lower and mid and upper pole region. Whenever we go for the Doppler study, we should see the blood flow and the peak systolic and diastolic, and then the pulsatility index, resistive index, and so these the Doppler study. I don't want to go into that detail. Here we can appreciate the very good flow that is distributed uniformly to the whole bulk of the kidney. So now I'm going to scan the left kidney. अब आप ये देखें कि ये लेफ्ट किडनी है, पेशेंट लेफ्ट लेटरल डेकोबाइटस पोजीशन में है. Left kidney is rather difficult to scan because of it is under the ribs. लेकिन फिर भी if you are expert in scanning and in probe handling तो आप easily जो है ना इसको भी देख सकते हैं. यहाँ भी ऐसे ही हम देख सकते हैं, ये अपर पोल है, ये लोअर पोल है, ये पैरामिड ब्लैक, ये कॉर्टेक्स लेस ब्लैक लेकिन हाइपोक्विक, ये साइनस है जिसमें फिर एक्वजेनिक है, और ये फिर पोस्टीरियर कॉर्टेक्स, ये एंटीरियर कॉर्टेक्स, ये पैरामिड यहाँ भी होते हैं, ये नहीं कहेंगे कि यहाँ नहीं होते. ये चार नहीं कहे, ये आपकी एंटीरियर साइड ऑफ द किडनी है, ये पोस्टीरियर साइड ऑफ किडनी है. तो यहाँ पे भी आपको फ्रॉम आउटर टू इनर पहले कॉर्टेक्स पर कैप्सूल होगा, जैसे ये लाइन कर रहा है, ये कैप्सूल हो जाएगा, फिर कॉर्टेक्स हो जाएगा, फिर ये पैरामिड हो जाएंगे, फिर सेंट्रल रीजन जो है ना रीनल साइनस कहलाता है, जिसमें फैट ज्यादा मिकदार में होती है. बाकी ये जितने भी लिम्फेटिक है, नर्व्स हैं, ब्लड वेसल, कनेक्टिव टिश्यू, कलेक्टिंग सिस्टम, वो सारा इधर भी होते हैं. तो उनकी वाल्स की जो इंटरफेसेस होती हैं आपस में कंबाइन करती है, इंटरफेस बन जाती है. तो साउंड वेव जब पड़ती है तो इन इंटरफेसेस की वजह से बहुत सारी साउंड वेव वापस रिफ्लेक्ट हो जाती है, जिसकी वजह से ये ब्राइट नजर आता है एज कम्पेयर टू कॉर्टेक्स एंड. और ये पैरामिड्स क्यों है कि डार्क होते हैं कि इसमें यूरिन होता है, फ्लूइड होता है मोर देन कॉर्टेक्स एंड देन साइनस. अब जैसे आप देखेंगे कि यहाँ पे अगर यूरिन जमा हो जाए, हाइड्रोनेफ्रोसिस हो जाए, तो ये भी ब्लैक हो जाएगा कलेक्टिंग सिस्टम, और ये कलेक्टिंग सिस्टम जो है ना फिर ये साइनस फैट अदर टिश्यूज को स्प्लिट कर देगा. तो आपको फिर ये चीजें जो बहुत ब्राइट नजर आएगी कम नजर आएगी. क्यों? तो उनको स्प्लिट करेगा, डिस्प्लेस करेगा, कंप्रेस करेगा, तो फिर वो कंप्रेस हो जाएंगे. और ये फिर अपर पोल, लोअर पोल, ये इंटरपोलर रीजन और मिड पोलर रीजन, फॉर सिंप्लिसिटी हम मिड पोल रीजन भी कह सकते हैं. तो इस चीज को कंफ्यूज ना करें. So this was all about the normal anatomy of the kidney. So whenever there will be pathology of the kidneys, gradually I will show what would be the pathology. इसमें मैसेज भी हो सकते हैं, स्टोन्स भी हो सकते हैं, हाइड्रोनेफ्रोसिस भी हो सकती है, एब्सेस भी हो सकती है, अच्छा जी, सिस्ट भी हो सकती हैं, अच्छा रीनल किडनी डिजीज भी हो सकती है जिसमें क्रोनिक किडनी डिजीज, मेडुलरी नेफ्रोकैल्सिनोसिस, यानी पैरामिड्स में आपके ये जो पैरामिड जिसमें कैल्शियम जमा हो जाए, कॉर्टेक्स में कैल्शियम जमा हो जाती है, जिसको हम कॉर्टिकल नेफ्रोकैल्सिनोसिस कहते हैं. तो सिस्ट भी होती हैं, और आपको हाइड्रोनेफ्रोसिस, पायोहाइड्रोनेफ्रोसिस के पास आ रही है, कुछ नजर आ रहे हैं, तो ये भी आपको नजर आ सकती हैं. तो और भी बहुत सारी कंडीशन है. तो इंशाल्लाह whenever we will come across the pathology, we will discuss that pathology. So this was all about the normal anatomy of the kidney, sonographic anatomy of the kidney. We sonographically we cannot appreciate the collecting duct, means proximal distal convoluted tubule in the cortex, a loop of Henle collecting duct, straight duct in the medulla, pyramids, because sonographically they are not appreciable, not appreciated. This was all about the kidney. Thank you very much.